Yeah, I have my little light. Could you hand me the light there? Thanks. And I'm going to check the glossopharyngeal and the vagus. Say ah. And while I'm doing that, I'm also looking at the tonsils. Are they present, number one? And I have to use a grading system. +1 means they're present, but +4 means the tonsils are enlarged and they're practically touching each other. I'm also looking to see if there's any exudates on the tonsils, like any white pus, extra redness, and hers are fine. And I'm also going to check her tongue. Could you stick it out for the hypoglossal, which is what cranial nerve? Huh? Can't hear you. Thank you. Her tongue is midline. It's pink. It's moist. Now I'm going to check to see if there's any lesions.
12.
Gee, I hate to waste one the whole thing, but okay. Could you stick out your
I
tongue?
just want to mention one thing. Some of the things that Dr. Janelli is talking about will look familiar on Tuesday. Some of the, in other words, some of the material she's talking about you'll see on the test. So I'm hoping you're
Oh
paying
boy.
close
I didn't know
attention.
that. Okay, stick out your
But
tongue.
it's a good review for the final exam, not just the practicum, is what I'm trying to say.
I'm checking the margins of the tongue for any lesions. I don't feel any. Why? Because 80% of cancers of the tongue occur on the margins. Okay, so hers are fine. I'm also going to palpate her buccal mucosa. Unfortunately, these gloves don't have any flavoring to them. I'm just feeling if there's any lesions there. There aren't. It's moist. It's pink. I'm also looking at the condition of her teeth. I already know from my subjective questions that she sees a dentist every 6 months. She doesn't have any dentures or partial plates or anything like that. Her teeth are in good repair. Personal oral hygiene is good. She's not missing or have any broken teeth. Then I also look at her gums. I'm looking to see that there's no retraction, which means that there's more of the teeth showing than should, that there's no bleeding from the gums, there's not edematous or any swelling of the gums. Was there anything else I'm supposed to check inside the mouth there? I did that when I asked her to say ah. On phonation, her soft palate rose.
And you said we don't need to do the gag reflex?
Please do not. Because if you're checking the glossopharyngeal, the vagus and the glossopharyngeal work together. So you don't have to do the gag.
Do we have to move it like my tongue like side to side, or is that like the same thing as she did when she like just?
She was looking, yeah, you could, you know. if you want-
Either way, you could do that too. What else? I don't know. Yes.
For the palate, how would you just write that? The palate?
Oh, I could say the uvula rose on phonation.
Okay.
Phonation means they said ah.
You could also say no lesions, pink, moist.
Okay.
And aren't you supposed to describe the tonsils? They're present or not present?
Right, and grade them.
And grade.
Yeah, that's for the throat though, it's this tonsillar area.
Okay.
Under mouth it says palate.
Okay, all you're looking is whether the palate rises when they say ah. You say rises on phonation. And once you have your gloves on, try to do everything that you need to do while the gloves are on, even though it might not be in step.
Okay.
So Molly, you're specifically wanting to know how to document that?
Yeah.
Exudates would be like something hanging from the tonsil that shouldn't be there. It could be red or it could be white. You know what a normal tonsil looks like if there's anything hanging from it. And most likely your client will tell you they've had a sore throat. You can't have exudates without feeling something there.
History of tongue.
Anything else? Okay. Well, I wish you all luck. I'm finished unless Dr. Scafidi has something she wants you to.
Well, I'm not sure if